You know me, I'm Trisha, your nurse, but for today, or last night, this is Miguel, and he's gonna be your nurse, for the day shift. Do you wanna put your name up there? Okay, so we're gonna go ahead and do report. We like to do bedside report here. So we're gonna kind of talk about what brought you in and your assessment and stuff like that. If you guys have any questions, just let us know.
Okay.
All right, so, Amanda, let me check your name band. Sorry, I'll shake your hand too. Amanda Phillips, what is your date of birth?
3/3/85.
Okay, and she does have an allergy to Cipro too.
Okay.
So she came in yesterday with some complaints of low back pain for a couple of days, and then she also noticed some blood in her urine. So she found, they found when they were working her up that she has a kidney stone in her right kidney that's obstructing some flow.
Okay.
So doctor-wise, she's got Dr. Danshu for her hospitalist, and then Dr. Swami has been consulted for nephrology. Past medical history, she has kidney stones 2 years ago, and she had a UTI that she was hospitalized for last year. She had her tonsils out as a child, and recently she's been diagnosed as a pre-diabetic, so we've been doing some education on that also. Her medical power of attorney is her husband, and his name is David. His number is in the computer, and of course she can give it to you too.
Okay.
She's in PO right now because we're waiting what the plan's gonna be. No isolation, obviously no restraints for her today. And we're doing AccuChecks every 6 hours because she's in PO. She's up with a cyst, just one person, because we're giving her pain medication and the pain. She has the allergy band in place. She is alert and oriented ×4. Pupils are equal and reactive. Grips, pushes, and pulls are all equal and strong. Her pain level was at 8 out of 10, and about an hour ago I gave her 2 milligrams of morphine, decrease it to a 6 out of 10. Temp max 39.1, and I did notify the physician of that, and I also gave her 650 milligrams of Tylenol PO.
Okay.
She's been sinus tach, low hundreds to 110s for me. Blood pressures have been running in the 130s to 80s over 90s. She's on room air, 96% have been her SOTs. Respiratory rate increases when she's in pain, so she's been anywhere from 18 to 24. Her lung sounds are clear bilaterally. Her bowel sounds are positive in all 4 quadrants, abdomen soft, non-tender. Last bowel movement was yesterday, I think is what she told me. Okay. For her urination, we do have a strainer in the toilet, so when you go to the bathroom or if you find anything, she needs to strain all urine, and if there's any stones that you find, you need to send those down to lab.
Okay.
And her urine has been pretty red and cloudy.
Yeah, it seems like a lot of blood. I'm kind of worried about that. Do you think that means I might need blood or anything?
So we'll just keep monitoring when your H&H has been stable for us so far, but we'll monitor those blood levels throughout the day, and if there's anything that increases, just let us know.
Okay.
For her IVs, she's got the 20 gauge in her right forearm, and the infusion is normal saline going at 150 mils an hour, and you can see that we have that correct. All right.
Okay.
Yeah, we always like to confirm those things for sure. Her skin is intact and it's been warm and dry for me. For abnormal labs, she did have the blood in the urine like I told you about. Her bun is 26, creatinine 1.5, most likely related to that kidney stone that she's got going on. WBCs are 15. Her H&H was 12 and 32, and her platelets and PTINR were normal in case they needed to do any procedures. Ultrasound is how they confirmed that right kidney stone, and they followed that with a CT scan of her abdomen and pelvis, which showed that calculi in the right kidney, and it is obstructing flow.
Oh, okay.
So we'll have to keep a close eye on her urine output. The wish list or recommendations, we just kind of want to know what the plan is, but hopefully Dr. Swami will be in soon. He had mentioned in his note possible lithotripsy, even nephrostomy tube if she doesn't start producing more urine, or just fluids and wait for it to pass. And then if you will also ask him about increasing that pain medication, because the 2 milligrams is just not enough for a 2-hour period.
Yeah, of course.
Okay. With our other information up here, you know that Miguel's gonna be your nurse, and Cindy already came in and introduced herself. Okay, so Cindy will be your CNA today. Dr. Dancho and Dr. Swami, like we talked about, those are gonna be your physicians. You can't have anything to drink or eat, and that's what we call NPO, just so you know. I see that your pain goal is a 3, and we're not at that level, so we'll work on following up with Dr. Dancho to find out if we can get you some more morphine, okay? If you have any questions, either of you, and you're thinking about it and we're not in here, go ahead and write them up on the board, and so that we can address those when the physician comes, okay? When can you eat? Like we said, we have to wait for the doctor to come in and talk to you guys about that. Our ultimate goal is to keep you safe. So please call us if you need any help with anything, and we'll work on getting that pain controlled. We're gonna do your AccuChecks every 6 hours because you're not able to eat or drink anything right now. And for hourly rounding, every hour we'll be coming in to make sure you're okay. So, but if you need us, if between those times, please let us know.
Okay.
All right, do you guys have any questions for us?
No, I don't think so, not right now.
Okay, how about you? Are you good?
I do not.
Okay, all right, we're gonna move on to our next room, but if you guys need anything, you let us know.
Okay.
Okay, thank you.